I'm Lenora Umstead. I'm 19 and I'm a nursing major at Towson University. I always knew that I wanted to help people, as cliche as that is, but I thought, I've always been a nurturing type of person, and so I thought I wanted to teach for a really long time. But then the COVID pandemic hit and I saw how much the teachers were struggling, and then that opened my eyes to how much teachers struggle with or without a global pandemic happening. And my grandpa and my brother were always in the hospital because my grandpa struggled a lot with his lungs and his heart because he was a big time smoker. And and my brother had Menkes disease, so he just wasn't getting enough copper throughout his body. So that led to him having a lot of seizures, and so I was always in the hospital, not for myself, but for other people in my family for 2.5 years, actually, because he passed when he was 4.5. For 2.5 years, I was in the hospital. I was seeing my mom medically take care of him, even though she's not personally a nurse, but at this point she might as well be. But just seeing that medical stuff, and he had a lot of different therapists come to the house, and I saw that all the time. But I think from that, I gained a lot more empathy and sympathy and compassion for people that others who don't go through that sort of trauma as a kid would gather. Nursing takes up all of my time, almost all of it. I am forced to socialize. So thank you for that. But I am forced to socialize, which is very nice because I do need to take breaks. But if I had the ability to, I would be studying all the time just because I feel so overwhelmed that I need to know all of this stuff in such a short amount of time. I probably study like it's a full-time job. I know some people are like, you are insane for wanting to work in the ER, but I like the pace of it, and I like the high stress of it because I work much better when I have a lot on my plate, and I work better when I'm either telling people what to do or being told what to do, and that is a lot of what the ER is. I'm scared of the fact that I have all these people's lives in my hands, and I'm not just advocating for the patient, I'm advocating for myself and what my knowledge is. Throughout middle school and high school, I was kind of like a pushover. People could do really whatever they wanted, and I'd be like, oh, sorry, and apologize for their actions and their choices when it was not my responsibility. My teacher was like, you have to practice self-advocacy. I've grown a lot. I've told my academic advisor that, not just my academic advisor, but my teachers and friends and family and a lot of people who doubt me a little bit, because there is a lot of doubt in this field, that I want this and I will work hard for this and I do have what it takes, even if it's not what they think is correct. Yeah. There are a lot of struggles that come with being a nursing student and wanting to go into the profession. A lot of it is people telling you you're not good enough. It's just a lot of no's and very few yeses. My nursing friends are also my competition. I could be best friends with someone, but if she outperforms me in classes and her GPA is so much better than mine, then she's guaranteed more of a spot than I am. You don't know if you should be a fake friend to these people. You don't know if you should just be like, ooh, that quiz was so easy, you don't have to study, and then watch them fail it, or if you should actually look out for your friends and be like, that was really hard, you should study a little bit more than I did, and help them get to where you want to be and give them, basically give up your position. And the second thing I hate, really hate this, is that when you apply, they really only look at your GPA. They'll look at your overall GPA of all the classes you've taken with your cores, and they'll look at your science GPA. And if both of those are not up to standard, they just kind of brush you away, and then they'll come back to you to either deny you or put you on the wait list. You are only a number, and you are not a person. And I am so much more than just a number. I have empathy, I have compassion, I have the drive, I have so much passion for nursing that I didn't realize I had until I started studying more and more. So I saw all of the care happening that nurses give, and I saw how much more hands-on they are than doctors when it comes to patients' health care. And I think the loss of my brother and my grandpa being a little bit insane in the hospital and everything kind of led to me thinking more and more. One thing led to another, and I was like, yeah, no, nursing sounds great.